The next part is about the quality of the incision. The incision should be ayatah, vishalah, samah, suibhaktah, nirashrayati, vranagunaha. The same is mentioned in the form of shloka. Ayatascha, vishalascha, suibhakto, nirashrayah, prapalakritaschapi, vranaha, karmanisha shade. And then qualities of the surgeon also are mentioned. Shauryam, Ashukriya, Shastrateksham, Asvedavepatuhu, Asammohascha Vedyasya, Shastra Karmani Shasyade. The quality of the incision should be, it should be long enough to reach to the area, and it should be wide enough to have the protocol, whatever the surgery has to be done. And Subhibhakta, it should be dissected well. All the structures in between we are coming through when you make an incision should be dissected properly. And at the end of the surgery, the target of the surgery should be achieved. Nirashraya is where, suppose if you have to remove the appendix, you have to remove the appendix completely. If it is about the drainage of the pus, ensure that all the pus is drained out. So Nirashraya is the target of the surgery should be achieved properly. And another very important, crucial is Prakta Kalakritaha. The incision should be done or a surgical intervention should be done at the right time. Surgery is considered as a window of opportunity. It's not that the surgery is done anytime, anywhere, or as such. And that makes the difference between Ayurvedic surgery and the contemporary surgery. In the contemporary surgery, there is one major area of surgery is the preemptive surgery, preventive surgery, so that the disease doesn't occur. Before the disease has occurred, you do a surgery so that the disease doesn't occur. This is one of the approaches which Sushruta doesn't accept. Ayurvedic surgery doesn't accept. Ayurvedic surgery would be the surgery has to be done only when all the other options have failed and you are sure that the other options will not give the results, then the surgery has to be done. And the surgery has to be done at the right time. If it is delayed unnecessarily, there will be more complications as such. Now, preemptive surgery is one of the major areas of bread and butter of the current surgical practice. And like idea of a removal of the uterus after the age of 50 to ensure that the carcinoma of the uterus doesn't occur. And in a few years back, some 10 years back, I think, in 1999, 21 years back, maybe, this kind of a data was presented where 40% of the women in USA above the age of 50, their uterus were removed with an idea of prevention of the carcinoma of the uterus. And later it was found that by this virtually there is no advantage, and hence that protocol was discouraged. But still, that kind of unnecessary hysterectomy is there is a wave of hysterectomy still now, or that's also we call as a tsunami of hysterectomy continue in many countries, including in India. The statistics is quite hazardous. Historically, there is another very interesting episode. In the time of Churchill, Winston Churchill, who was the prime of UK, that England, during that stage there was a law included, a law incorporated, which said that all the persons who join military should undergo appendicectomy, so that the chances of a leave or medical leave during the service for the appendicectomy or appendicitis could be reduced. Incidence of appendicectomy was more in that period, and hence it was considered as a precondition. And this continued for about 3 to 4 years. And after they studied the data, they it was proved that with this there is not much of advantage, and that protocol was stopped. So preemptive surgery is not going to help much as such. Now this is one of the point of debate in the current surgical practice too. How far the preemptive surgery has to be continued, or when the preemptive surgery has to be regulated. These are all the issues of controversy. And in the particularly in the cardiology field, it has gone to the peak, and hence you have now two different classes of cardiologists, interventional and non-interventional cardiologists as such, and that's about the current controversy. Sushruta has a very clear idea that kind of a controversy should not be. Instead, the surgery has to be done only when the condition demands and should be at the right time. So, Prapta Kala Kritaha, that word is a very important word. Of course, the logic of preventive surgery also is a very poor logic. Suppose you remove the uterus to prevent the malignancy of the uterus, then I would say you remove the heart to prevent the cardiac complications, remove the head to remove the avoid the possibility of headache. This kind of a logic doesn't have any value as such. That's about the other issue, controversial issue, which we should be aware and we should be able to present Sushruta in a very proper manner. Then the other issue is about the quality of a surgeon. Shauryam, the surgeon should be brave enough to tolerate the stress of surgery. And as I told, surgical career is a stressful career, and hence the life of surgeons is supposed to be lesser. We have discussed that part in the earlier sessions. Ashukriya, surgeon is supposed to do the protocol or procedure quickly, and Shastratekshnam, the quality of the instruments should be quite good. It should be optimum. Asveda Vepatu and Asamoha, sweating, tremor, and confusion. These are all the results of a improper knowledge. When there is a confusion, you will have sweating, tremors, or even confusion, the critical confusion as such. And this can be avoided only by a proper study and proper preparation. Then only the surgeon has to make a quick decisions. On the table, many times the surgeon has to change the decision, and this is possible only when a clear idea, the clarity of idea is that, and hence training of a surgeon is always very rigorous, and every aspect of the protocol has to be known, and surgeon would be giving more importance to the possible complications than really the smooth ongoing process. Smooth ongoing process, everyone will be ready, but a proper surgeon and a good surgeon would always be expecting the complications and should be prepared to meet with the complications. This is the clear idea, and that's what Sushruta says. Now coming to the Ayata and Vishala, in the current protocol, we follow a Hilton's method of drainage for a drainage of an abscess, and that Hilton's method of drainage is exactly what Ayata and Vishala would say. That where you make an incision in a area where there is really the maximum fluctuation is seen, pus is seen and pus is drained out, and it should be wide enough. The same issue in the current protocol also is the same issue which is mentioned with the more diagrammatic presentations as such. Now, once you make an incision, then if the one incision is good enough to drain the contents out, and this is particularly true in case of an abscess drainage, then you may have to make more than one incisions or the counter incisions. This is exactly again what Sushruta says. Eke navavranena ashuddhim ane nantara buddhya aveksha aparan pranan kuryat bhavati jatra yato yato gatim vidyat utsango yatra yatra cha tatra yatra pranam kuryat yatha dosho nati study. You have to ensure that the cumulated pus will not get retained in the area. You have to ensure that it gets out as such. Now, this kind of a concept is very critical. Of course, in any situation, this is true, but it's very critical in case of a breast abscess. In the breast abscess, the standard protocol of dealing with the breast abscess is never to be dealt with only one incision. You will have to make more than one incision. A counter incision has to be done, and the counter incision always has to be on the gravitational dependent area. You have to make one incision to drain out the pus, and because the breast is a soft tissue, there is always a possibility of the accumulation of the pus left over, and hence you will have to make an incision on the gravitational dependent area, ensure that the pus is continuously drained out, and then only a proper healing would be expected. That's what Sushruta says. Yato yato gatim vidyata. Wherever there is a possibility of movement of the pus, that has to be drained out. Utsango yatra yatra. Wherever there is a collection, that collection has to be removed. And the point of incision is made out by palpating the area where the fluctuation is elicited clearly. In case of the breast, this may not be possible easily because the fluctuation is felt even otherwise in the normal breast conditions, and hence you have to be very careful in draining out the pus. Now, some more of the anatomical issues which are mentioned by Sushruta. तत्र भ्रूगण्ड शंख ललाट अक्षि पुट वोस्त दंत वेस्ट कक्षा कुक्षि वंशनेषु तिर्यच्छेदः उक्तः चंद्रमंडलवच्छेदान् पाणिपादेषु कारयेत अर्धचंद्राकृतिश्चापि गुदे मेढ्रे च बुद्धिमान् अन्यथा तु शिरास्नायुच्छेदनम् अतिमात्रं वेदना चिराद्व्रणसंरोहः मांसकन्दी प्रादुर्भावश्चेति. Now, whenever you make an incision in a specific anatomical area like around the orbits, or over the face, at the facial area, the incision has to be oblique, and in the gum as well as in the axilla and in the inguinal area, the incision has to be oblique. Tiriyak chedah uktah. Now, why? The reason is very important and very critical issue. What Sushruta has said is a basic principle of anatomy. Over the face and the scalp, the speciality there is there is a cutaneous insertion of the muscles, and almost all the facial muscles, particularly the orbital muscles, muscles around the orbits, or muscles around the oral area, they are circular in nature, and their incision, this insertion over the skin is in an oblique fashion. And even others, the facial muscles, all the facial muscles, they have a oblique insertion over the skin area, and hence whenever you make an incision, if at all you follow the universal straight line incisions, the scar will be more, and the wound may not really heal well as such. Scar will be wider, wound may not heal well, and hence instead of cutting the muscle fibers, if at all you have to split the muscle fibers, the incision has to be oblique as such. And in case of the palmar area, the areas like a hand where you have the palmar fascia, as well as in the perianal area, the problem would be the other way. The incision may get closed easily in the palmar area, particularly hand infections. When you drain the hand infections, if the pus is collected below the palmar fascia as such, in the deeper compartment, there is always a possibility that the pus may not get drained easily, and it may flow into the flexor compartment of the forearm, producing a abscess, collapsed abscess, an abscess which can extend into the forearm and produce the complications. And hand infections are always considered as to be a high risk propositions. Now, one of the major problem with these hand infections is if you make an incision in and then drain out, the wound may get closed immediately because of the fascia as such, and hence the you may drain once, but there would be further accumulation, and hence the recurrence will be more. So whenever you make an incision there, you have to make an incision in such a way that wound doesn't close easily. So in the present setup, we prefer to have a crisscrossing incisions. When you make a crisscrossing incision, the gap will be remaining open for a wider area and wider duration or longer duration, and hence the pus will drain out. What Sushruta has said is either Chandramandala, the incision should be either circular or Ardha Chandra, the semi-lunar. Now, in the crisscrossing incisions, if you cut the edge of that crisscrossing incision, then it becomes Chandramandala, circular. Now, we may not prefer to have that edge cut because cutting the edge would result in more tissue loss. So, what we would prefer in the contemporary situation is we make a crisscrossing incision and then insert a wick so that it remains open as such. So, that tissue loss may be minimized. It may not be a totally circular incision, but it could be a crisscrossing incision achieving the same purpose. So, that idea of all that anatomical variabilities which can result in complications were known to Sushruta and they were really highlighted. So you should appreciate the knowledge of anatomy of Sushruta as such. Then in the anal area, why Ardhachandrakriti, semi-lunar, we now have a very popular law called as Good-Sal's law, and most of the times in the examination it's a enigma to the students. That Good-Sal's law is again suggestive of the same issue. Whenever there is a anal fistula, perianal fistula, if it is in the posterior side half, then the tract would be oblique because of the distribution of lymphatic vessels. The lymphatic vessels are distributed in an oblique manner on the posterior side, whereas on the anterior side they will be straight. So whenever you deal with a fistula tract in the posterior side, the tract would be curved. This is what the basic theme of Good-Sal's law. And what Sushruta has said is whenever you make an incision in the perianal area, it should be Ardhachandrakriti, semi-lunar. That follows the same. So Good-Sal's law is a copy of what Sushruta has said. Then comes the other issue. Muralidhara Sharma Ashwini Bhagandhara Mukharogeshu Abhuktavatak Karma Kurvita. In the surgeries which involves the abdomen, the peritoneal cavity, like Muralidhara, the obstructed labor, Udara, abdominal diseases, Ashras, rectal pathologies, Ashmari, the stones, Bhagandara, Mukharogesh, oral cavity surgeries. Sushruta suggests that the patient should be kept in a empty stomach conditions. But at the same time, in the later chapter, in the 24th chapter, Sushruta suggests about another sentence. The sentence is Prak Shastra Karmashta Ishtam Bhojayet Aturam Vishaka Madhyapam Payet Madhyam Tikshnam Yo Vedanasaha. We'll have more discussion on this issue when we come to that part as such. But we'll have to have a primary idea what is the issue. Sushruta has suggested a general statement like before the surgery, patient should be given a food which is nourishing and which is liked by the patient. The reason is namurchati anna sanyogat matta shastram nabudyate. The other part is about the alcohol. Alcohol, we will have a more discussion in the later period. We will not discuss about the alcohol now. The other one important part is about the food. The food is given, suggested to be given in surgeries, whereas in the surgeries involving the abdomen, the food patient should be kept in an empty stomach. The reason why the food is suggested is that the patient would have a better pain tolerance if the patient has a food in the body. So this is the exact issue. Then the other part, Shastram, Nabudhyate and Madhya, this will have a detailed discussion later on when we go into that part later. Tasmad avashyam bhuktavyam rogeshu mukteshu karmani. In specific conditions, the patient has to be given the food. Now, in the present surgical protocol also, that keeping the patient in empty stomach or fasting is another issue of controversy, confusion. Most of the times there will be always some confusion like how far the patient has it kept orally. In the earlier days of surgery, a 12 hours fasting was a standard protocol. But recently the issues have changed and the current guideline, the latest of the guideline, universal guideline given by the anesthesiologist task force is if the patient is having clear fluid up to 2 hours, it can be given. There is no need of minimum fasting period would be only 2 hours, and clear fluid can be given up to 2 hours prior to the anesthesia. Breast milk it is 4 hours. In children, infant formula 6 hours. Non-human milk 6 hours. Light meal 6 hours, and the other heavy food 8 hours. 8 hours is considered as a standard protocol. The basic idea of this preventing the food to the patient is to avoid aspiration pneumonia, particularly if the patient is under general anesthesia. Surgery has been under general anesthesia. There is a possibility that the patient may vomit out, and as the patient vomits out, there is a possibility of aspiration in the third phase of general anesthesia. Moreover, even in other conditions, in spinal anesthesia, many of the or any other regional anesthesia, a vomiting reflex could be triggered, and hence food is abandoned. But at the same time, there is another important issue. If the surgery is done in the abdomen and the intestines are handled, after the handling of the intestines, there will be always a transient paralytic ileus. Temporarily, the movements of the intestines will be blocked, and it depends upon how far the handling is done. If intestines are handled roughly, the duration will be more. Duration of the paralytic ileus will be more. Whereas if it's handled delicately, the duration will be lesser. Moreover, the other factor which decides about the duration of paralytic ileus is the presence or absence of the food. If there is a food present in the intestines, the time of duration of that paralytic stage will be longer. Whereas if the intestines are empty, the recovery would be faster. So with an idea of recovery, faster recovery, in a patient who has to be operated upon the abdomen and the intestines are to be handled, it is better to keep the patient nil orally and empty the stomach, better the recovery. And that's exactly what Sushruta has said in case of Muralidhara Sharma 𝐕𝐢𝐬𝐢 𝐏𝐚𝐜𝐿. Whereas in the other conditions, to have a better pain tolerance, patient is given a light food. So that a very basic issue of the physiology is also included in the suggestions about the preparation for the surgery. Now, once the surgery is done, the next is तद शस्त्रम अवचार्य शीताभिः आतुरम आश्वास्य समन्तात् परिपीड्य अंगुल्य व्रणम अभिमृत्य प्रक्षाल्य कषायेन प्रोतेन उदकम आदाय तिलकल्कमधुसर्पिप्रगाढाम् औषधयुक्तां नातिस्निग्धां नातिरुक्षां वर्तिं प्रणिदध्यात् ततः कल्केनाच्छाद्य घनां कबलिकां दत्त्वा वस्त्रपट्टेन बध्नीयात् वेदना रक्षोग्नैः धूपैः धूपयेत् रक्षोग्नैश्च मन्त्रैः रक्षां कुर्वेत. Now once you have made an incision, ensure that the patient is in a proper condition. Now this is Shitabhiyarbhiya Atromashwasya. Patient has to be recovered. Ensure that the patient recovers well. Resuscitate if necessary. This is true in case of a surgery done without anesthesia. But in the present day situation, anesthetist will be taking the responsibility of ensuring the patient's condition as such. Then you have to ensure that the pus is drained out. Now this is an example of the pus drainage, and hence the pus is drained out. And once the pus is drained out, the opening which you have made should be kept open. And to ensure that the pus is continuously drained out, you have to insert a wick. The wick which is suggested by Sushruta was a medicated wick. Tilakalka madhusarpi pragadham aushadayukta. The bandage gauze is dipped in tilakalka madhu, etc., and then it's inserted in. Now, in the present day situation, we may use a dry gauze, or we may have the different sorts of the corrugated wicks, or maybe a vacuum drainage, to ensure that there is a continuous drainage. The pus is not accumulated further. And then put a thick bandage as such. Then the dhupana is suggested by Sushruta. The materials used for dhupana are Gugula, Guru, Sarja, Savacha, Gaurav, Sarshapa, Lavana, Nimba, Patra, Mishri, Ajayukti, Dhupayeta. Dhupana is considered as one of the protocols in the post-operative period by which the possibility of infection could be reduced as such. And now, of course, there are many studies done in many centers about the utility of these, and the advantage of wound healing are also now almost established in many thesis presentations. Of course, practically to do that would be very tedious procedure, so we may not really implement this in the routine post-operative conditions. Only in very severely infected wounds, this dhupana may be tried, dhupana may be continued as such. It becomes a bit laborious. Anyway, that's one part. Then the other part is about the Raksha Karma. Raksha Karma, Sushruta suggests about the use of mantra. How far these mantras would be useful or not, again, issue of controversy. I will not go into that part much as such. But the content of the mantra is to ensure that the patient is in a better position, not counseling the patient, like you are better protected and you do not have a risk of the complications. And there are many components of the universe which can protect you. So this kind of a counseling, positive counseling, creates a positive spirit in the patient. And now we know that having a positive outcome, positive outlook would always result in a positive outcome. This is known now. But our law doesn't allow that. So that's the issue. Anyway, all that mantra has to be considered from the point of view of creating a positive outlook in the patient. Now, the mantra is Krityanam Pratihatartam Tatha Rakshobhesya cha Raksha Karma Karishyami Brahma Tadanmanyatam Nagaha Pishachaha Gandharvaha Pitaro Yaksharakshasaha Abhidravanti ye Tvam Brahmadhyaha Ghantan Sada Prithivyam Antariksheta ye Charanti Nishacharaha Dikshuva Astu Nimasascha Pantvam Te Namaskataha. Now all these varieties, names like Naga, Pishacha, Gandharva, these are all the invisible organisms which are present in the universe, the microorganisms which can infect you, and you are better protected. This is what Sushruta said. Whether it's an antibiotic would be effective as, or this would be as effective as antibiotic, these are all the issue of controversy. We will not go into that. Then Pantatvam Mulayo Brahmanyaha Divyaha Rajashestada Parvatashtiva Nadyascha Sarvaha Sarvecha Sagaraha Agni Rakshatu Te Dihvam Pranan Vaistathevacha Somo Vyanam Apanam Pardanya Parirakshado Udanam Vijita Pantu Samanam Stanaitavaha Balam Indro Balapatihi Manu Manye Matim Tatha Kamamste Pantu Gandharvaha Satum Indrio Abhirakshado Prajnam Te Varuno Raja Samudro Nabhimandalam Chakshu Suryo Dishashotre Chandamaha Pathe Manaha Nakshatrani Sadarupam Chaya Padantutam Nishastava Retastu Apyayantu Apaha Romani Aushadhyastata Akasham Khanite Pantu Deham Tava Vasundhara Vaishvanaraha Shirah Patu Vishnustava Parakramam Paurusham Purushasresto Brahma Atmanam Dhruvo Yeta Dehe Visheshena Tava Nityahi Devataha Etastvam Satadam Pantu Dirgham Ayuho Apnuhi Swasti De Bhagavan Brahma Swasti Devascha Kurvadam Swasti Te Chandrasuryote Swasti Narada Parvato स्वस्ति अग्निश्चैव वायुश्च स्वस्ति देवाः सहेन्द्रगाः पितामहः कृता रक्षाः स्वस्ति आयुर्वर्धतां तव ईतयस्ते प्रशाम्यन्तु सदा गतव्यतः इति स्वाहा एतैः वेदात्मिकैः मन्त्रैः कृत्या व्याधिविनाशिनीः मयैव कृतरक्षस्त्वं दीर्घम् आयुः अवाप्नुहि. All these are to assure the patient like the universe has all the remedies for all the problems, and as long as you are in consonance with the universe, you will be better protected. This is the basic theme as it. More detail about that, more controversy about that, we will just avoid that. Then the next is Tata Kritaraksham Atum Agaram Pravesha Acharikam Adishetar. The patient has to be kept in a post-operative ward, and the protocols, the precautions to be taken during the post-operative period is suggested. Tata Tritiya Vimicya Evam Eva Bhagniyat Vastrapatena Nachayanam Tvaramana Aparidim Moksheta Dvitiya Divasa Parimokshanath Vigrati Ranashta Chirad Upasamrohati Tivra Rujascha Bhavati Ata Urdham Dosha Kala Baradina Veksha Kashaya Alepan Bandana Ahara Acharan Vidajata. Sushruta suggests that the bandage has to be opened on third day, not earlier than that. It could be opened only when, if at all you have to remove it on the second day, open it on the second day, there is a possibility that the wound may not heal well, it takes more time and the pain is more acid. The current guidelines in the surgery and maintenance of this post-operative bandages, it depends upon how the surgery is, the purpose of the surgery. If it is an infective surgery and there is a possibility of accumulation of the exudates, then the surgery, the bandage has to be opened earlier as such. It is accepted to do more frequent dressing changes during inflammatory phase. If there is inflammatory pathology, a frequent dressing is suggested. Otherwise, it's always like the 3 days gap is the standard protocol even now. The bandage has to be opened on third day. If it is a non-infective condition, if it is an infective condition, it could be opened earlier. This is the current guidelines as such. Regarding the post-operative care again, there is a standard note or standard protocol of the post-operative care, and that is about assessing the vital signs, pain control, rate and type of intravenous fluid, and so on. These are the current protocols of post-operative care. What Sushruta has said is almost the same. The only the ensure is the approach is slightly different. You have to ensure that the wound has healed well and there is no possibility of leftover. Now, particularly in case of abscess, there is no possibility of leftover or residual inflammatory product, and hence Nachayanam Tvaramana Santadosham Rupayeta. You have to give sufficient time for the wound to heal, and Sahi Alpena Apacharena Abhyantaram Utsanam Krutva Bhuyopi Vikaroti. तस्मात् अंतर्बहिश्चैव सुशुद्धं रूपयेतृणं रूढयपि अजीर्ण व्यायाम व्यवयादीन् विवर्जयेत् हर्षं क्रोधं भयं चापि यावत् स्थैर्योपसंभवात्. You have to ensure that all that pus is drained out and there is no further accumulation of the pus, and it should heal well, and even after healing for a long duration or till that wound has gained sufficient strength, patient should not do rigorous physical activity as well as emotional disturbances should be avoided, because there is a possibility of the dehiscence of the wound. Now, the duration of the bandage, like whether it has to be always all the 3 days, Sushruta says it depends upon the season, environmental factors. If it is a hot season, the duration between the two bandage changing could be lesser. If it is a cold season, it could be more. Hemante shishire chaiva vasante chapi mokshat trehat dvehat sharad grishma varsha. In case of sharad grishma varsha, the hot season, to maintain the hygiene, the bandage could be changed once in 2 days. So there is a flexibility. Though it's said like it has to be on third day, there is a flexibility depending upon the condition as such. Atipatishu rogeshu nechet vidhimam vishaka pradipta agaravat shigram pratakuryat pratikriyam. If it's an emergency, you need not follow all the guidelines. It's all, you can just deal with the patient as the situation arises, like as you deal with a house which has caught fire as such. या वेदना शस्त्र निपात जाता तीव्रा शरीरम प्रतनोति जंतोः घृतेन सा शांति उपैति सिक्ता कोस्नेन स्टी मधुकान्वितेन. The post-operative pain is controlled by a warm madhu yasti ghrita as per Sushruta's suggestion. Of course, how far it is effective, whereas the analgesics which we use, whether they are more effective or not, these are all the issues of controversy. We will not go into that part. And the post-operative pain management, The other protocols, it's not only about the Ghriza, the other part of the issues of post-operative pain management, we will be dealing with in later part when we go into further details. So this, for the present, we will just summarize at that part. With this, we will conclude today.